Are you someone who's suffering with a slip disc? Well, this is the video for you because I want to give you my 4 top tips for how you can be treating and self-managing a slip disc. So let's go. Thanks for checking out the channel. If you're new here, it's great to have you. My name's John. I'm the head therapist here at John W Sports Injury. Here at John W Sports Injury, we want to do 3 simple things. We want to help you to understand your body. We want to improve and get rid of your pain so that you can be going to achieve your personal health, fitness, well-being goals. So if this sounds like some things you want to be checking out, make sure you hit that subscribe button and I'll keep you updated on some of these videos. So what I want to do is talk today about a slip disc, and quickly a quick bit of background before we dive into those 4 top tips. So when it comes to the term slip disc, it's a term that we're probably very familiar with, is used commonly, but it's not actually correct in terms of its description. I think that we get the impression that the disc actually slips out of position, which isn't the case. So let's talk about what the discs are. The discs are something that sit in between our vertebrae. They act as our sort of shock absorbers and allow all this to have movement really and to function. Think of these as like a donut where they have a jelly-like structure inside of them, which is the jam. Now, what can happen over time or as a result of trauma is that we can get one of 2 things happen to the disc. The disc can bulge, so if you like, the jam starts to push out at the outer surface of the donut. And then secondly, if it becomes a little bit more problematic, it can actually herniate and that jelly can come out of the donut. Now, I don't have any back pain and I don't have a diagnosed slip disc, but I could well be having bulging discs happen. So why is this happening and why is this a problem? And a reminder that this video is if you've been diagnosed with a slip disc, because many things can cause some of the things that we're about to talk about. But the discs are living in this space, and you can see here that this is a bulging disc. This structure, the disc has turned to red, and you can see that bulge happening. Why can that become a problem is that we have our nerves coming off of this spinal cord that come out and supply the rest of the body. So you may be familiar with this term of sciatica. We have the sciatic nerve that comes from the lumbar spine, and that supplies our legs. Now, these come out on the spine and run through this space. And in the most part, that happens quite happily. But when these bulges start to happen, what can happen if they become problematic is that they start to hit these nerves and become uncomfortable. And that's where we can start to get either this lower back pain or pain spreading throughout the legs. Now, as I mentioned, there's multiple things that can cause these sciatic type pains, but this is specifically talking about if a disc has slipped. And what I want to talk about in this video is the 4 things that you need to be doing. We're going to discuss how that you can be decompressing that spine, how you can be stretching that spine, how you can be rolling out, and how you can be mobilizing in order to help you live comfortably with a slip disc. So first thing we want to do is we want to decompress the spine. Now, why do we want this to happen? Well, we're going to talk about good movements and bad movements throughout this video. A good movement is going to be what we would term back extension. So if somebody's got a slip disc, they will often find it to be more comfortable to extend their back. But our problematic or bad movement is when we flex the spine, when we start to bend forwards. So why is this a problem and why does this aggravate your symptoms? Again, if we come back to thinking about the disc and how this works, if we start to flex the spine, then what happens is this can encourage that bulge, or it can encourage that movement to happen and perhaps knock it onto those nerves, or you can really feel the receptors in the area firing where you feel that pain. But we also have this better movement that we call extension, where we're looking to almost arch the back, if you like, because what that can do is help to restrict the bulge and really take some of the pressure off of those problematic discs. So we always want to be thinking of how can we get the pressure away from those discs. And a good way to do this is to try to decompress the spine. Now, there's a few ways you can do this, but a really nice way is to think of it as like hanging from something like a door frame. So find a door frame and hang on off of the architraves. Now, by hanging, you can have your feet in contact with the floor, but what we're looking to do is just arch that back. And really what we're looking to do here, if you like, is to lengthen the spine, to allow this space to be occurring in those areas and creating this decompressive effect. Now, if that's something that's a little bit difficult for you, a little bit sore or uncomfortable, that's not a problem, because you can do this simply looking to lie over the edge of the bed. And again, if we lie over the edge of the bed, keeping our hips off of that bed, that will also be creating this feeling of extension in the back and really looking to stretch out that back. And so the second tip, and where that then leads us onto, is how we can look to stretch that area. So again, if you have a slip disc, we want to be careful in how we're looking to stretch out this area. We don't want to be aggravating those symptoms. Remember that the good movement is to go into extension. So what I talk about here is a stretch that I call the cobra stretch. What we're looking to do is lay flat down onto the floor, keep our hips nice and flat on the floor, and slowly come up into that extended position. Now you can firstly do this on your elbows, and then you can look to extend as far as comfortable for you as you start to almost push up onto those hands. But remember that we want to be living within our pain threshold here. Now what I mean by that is that you shouldn't be feeling pain during this stretch. So take it up to that comfortable level, hold it there for 30 seconds. Then you can relax it off, and then you can repeat the stretch. And you might find that you're able to go a little bit further within your comfort zone. Remember, pain is there for a reason. So if it's hurting you, we're taking that stretch too far. Hold the stretch for 30 seconds and repeat 2 to 3 times. So that's the first 2 tips. And remember, if you're liking this stuff so far, you can show me that you like it by smashing that like button. Let's move on to the third tip. And here I bring in my trusty old friend, the lacrosse ball or hockey ball or cricket ball or anything you may have to hand. Those of you who follow my content will know that I like to use these where possible. What we're looking to do here is really look to manage some of those symptoms that might be coming about as a result of your slip disc or bulging disc, as I prefer to say. And what we want to do is simply take the ball and sit onto it in the areas that might be sore in those glutes. You can start upright and slowly take yourself off to the side, almost 45-degree position, and you'll feel that ball moving between the glute tissue. If you find a sore point, just hold on that. Feel the pressure of the ball on that sore area, and you'll start to feel that muscle desensitize. As I mentioned, what we're looking to do here is really manage those symptoms that are coming about as a result of the slip disc. And then my fourth and final tip for managing your slip disc or bulging disc is that we want to strengthen the surrounding area. Now, importantly, what I mean by this is strengthening our core. Now, before you dive off and do lots of sit-ups, because I've told you to strengthen those core, don't do that. Remember that the problematic movement is this flexion. So the sit-up is actually going to be really problematic for the slip disc. And that's why I'm not necessarily a fan of those, and have another video on my channel where I talk about not liking the sit-up. But what do I mean then by strengthening the core stability? Well, really, the core muscles are the deep muscles, the deep core muscles that are designed to be supporting that spine. When they're working, they'll be offloading that pressure. And there's lots of ways that we can work this core by keeping our back in a flat position. And really, the best core exercises, that's the aim, because what we want to be doing is making sure that we're remaining stable. So one of the exercises that I often recommend is what I term Supermans. And here we want to go into what we call a 4-point kneel. So hands on the floor, knees on the floor. Now we need to make sure that we keep that back flat. We make this a more difficult exercise to keep the back flat by starting to lift one arm. And then we bring that arm back, and then we repeat on the other side. As you lift that arm, you'll feel that temptation for the back to want to rock against the side that the arm is lift. But by keeping that back nice and flat, you should feel those deep core muscles firing, almost like a bracing sensation, in order to hold you in the correct position. And that's when you know you're firing those correct muscles to be supporting your spine. If we want to make this exercise a little bit more difficult, a little bit more progressive, what we can look to do is repeat the exact same exercise, but as we lift the arm, throw in the opposing leg. So as the left arm lifts, the right leg goes back. Now here we're reducing that base of support, so it becomes even more difficult to keep that back nice and flat. And as a result, a bigger challenge for those core muscles. But remember, as with the stretches, we're looking to live within this pain threshold. So if this is causing you pain, this is too difficult an exercise. Strip the exercise back and make it easier, and build your way up to these more difficult core exercises. So I hope that's been helpful for you. I wanted to cover some of my 4 quick tips, but I am feeling generous today, so another bonus to throw into your everyday life is that I've mentioned that flexion is this problematic movement. Now, when we're sitting, as I am now, we sit in a flex position, and as time progresses throughout the day, all of us, I'm sure, have a tendency to drop further into flexion. So We know that extension is going to be better for us. Ultimately, it's better for everybody. We're designed to be these sort of hunter-gatherers. We're designed to be moving around nice and upright, back extended. So break up periods of sitting in your get up and move around, because this movement is going to be much more better for managing long-term your slip disc or bulging disc pain and symptoms. So I hope that's all been helpful. Whilst it can be a frustrating condition and quite worrying condition, it's something that can certainly be managed and improved, and the research around that is always more and more supportive to this. But if you've got any other tips, any other things that have helped you, drop us a comment below, or let me know if any of these tips are things that you're going to implement in your daily routine and you're somebody who suffers with these symptoms. And if you do like this content, make sure you're hitting that subscribe button, and I've got another video here that you can use to help with your long-term health and well-being. I'll see you on the next one.